Right now we're going to move over to healthcare, and Milt, you're kind of doing yeoman duty here. You're going to be moderating that panel. Can you introduce us to your panelists and thematically where you guys are at? I mean, we had just talked about how healthcare has kind of gone on this, sped up time frame now. But I'd love to get more, perspective from you, where things are at, and also, what's interesting about Florida is it's always been a tax advantaged area for healthcare. So you have hotbeds like San Diego, California, Silicon Valley, the whole New York through Boston corridor, maybe a little bit of Philadelphia and Baltimore. But I think that Florida's always had a very friendly environment for healthcare. So maybe you guys can address that as well. So.
Okay, we will, Marty. Thank you. Appreciate it, everybody. So we'll be talking about opportunities in healthcare, and I want to introduce our panelist, Samantha Prokop. She's with Gunster in the Jacksonville office, and Alex Seifert is with Minerva Capital here in Miami. I want to welcome both of you, and I'd like to have you briefly introduce yourselves and give us a little background of your expertise and where you practice and what you do. Go ahead, Samantha.
Hello, good afternoon, everyone. So my name is Sam Prokop. As Milton said, I'm in Gunster's Jacksonville office, but work throughout the state of Florida with a lot of healthcare clients. I started my career out actually as in-house general counsel for a hospital system in Ohio, and was responsible for not only compliance, but then eventually helping them acquire physician practices. So they went on an acquisition spree. From there, I moved to Florida. I decided I did not like winter in Ohio. Had an opportunity with my firm to move to Florida and started representing more physician practices, non-hospital type providers, and working on merging them together, building mega groups, helping advise them on buy, sell, what are the opportunities, trying to attract PE and other types of investors. And so if you ask me right now what my main practice is, I'd say 75% of it is probably M&A work in the healthcare space. I also do general corporate mergers and acquisitions, and really focus on helping embattled practices come together and find solutions to the challenges they're facing so that they can ultimately, be sold or attract investors.
Hey, Alex.
Great. Thank you, Milton. Good to be part of this. It's a real honor. I've got probably a different kind of background than a lot of people in the group. Really excited to be part of this forum. So me personally, I come from a mix of military as well as civilian health tech experience. Over the last 26 years, I've been part of the evolution of new digital ecosystems and adoption of digital technologies. First in the military, where I served honorably as a U.S. aviator and aviation liaison officer working on Task Force 21, which was the military's experimental project to transition from an analog to fully digital warfighting machine. And that was an amazing experience. So after serving, I had the opportunity as a civilian to work for some of the leading companies in minimally invasive surgery, companies that are probably well-known: Stryker, Kroll, Storz, Endoscopy, Arthrex for the last 17 years, a very innovative Florida-based company. And all of these companies in surgery in the operating room really driving, new digital systems that drove efficiency, device connectivity, better controls, and ultimately, especially with the advent of robotics, less variability and better patient outcomes. So, being part of that world at the operative level and across multiple healthcare sectors around the world really put me in a great position when I joined Minerva Capital Group. So we're a Florida-based, female founder-led, highly diverse international private equity firm with a social impact mission. And our two core verticals are health tech as well as education. I've heard a lot about that this morning. So what we invest in are early growth, cutting edge disruptive companies who are developing those novel digital and robotic solutions, not only for the operating room, but for multiple points of care across the entire continuum of care. So we're seeing a lot of good activity in AI, machine learning, predictive analytics, telemedicine, telehealth, along with a solid, rich mix of brick and mortar type technologies like robotics in the surgical and assistive robotics sphere. So great to be with you today.
All right, great. That's a great background. So before we get to discussing the opportunities in healthcare looking forward, as the theme of today's conference is for 2021, I'd like to talk about 2020, which really started the year with a global pandemic and how important and what the impact was on healthcare. So give us, Sam, if you don't mind, your perspective on how the coronavirus pandemic has impacted healthcare, not just here in the United States, but globally, and who the losers and winners are as a result of the pandemic.
Sure. Well, it's been really interesting. When this all started, I think it started with a little bit of a panic for healthcare providers, right? We initially were worried that hospital systems were going to be overwhelmed. What does this look like? How quickly does this get out of control? Do we have enough supplies? What happens if our healthcare providers, get sick? And as a result of that, we saw, especially here in Florida, an executive order that stopped elective procedures. So in healthcare, whether it was hospitals or physician practices, surgeon groups, those providers that were providing those elective type services, elective surgeries and procedures, to be shut down really, I think, created a huge economic impact on them. A lot of people don't realize how hard hospitals were hit. You think, oh gosh, a lot of people are sick, that'd be good for hospitals and their revenue. But in reality, that emergency care for hospitals is really expensive, and they subsidize that with their elective procedures, which are really profitable. So to be shut down took a big toll. You had orthopedic practices, cardiology practices, all kinds of different specialty surgery groups who couldn't, had owned surgery centers, had rent to pay, paying their ASC rent, paying their office rent, that were really hit hard. And I think probably if we're talking about winners and losers, those are probably your, I don't want to say losers of this, I think we're going to have, with the stimulus money and the turnaround on this, there will be some upside at some point. But I did see home health agencies seem to do really well during the pandemic so far. A lot of hospitals contracted with them to say, hey, go into service patients in their homes. There became a huge need for that. Staffing companies I represented seemed to do really well because people needed, temporary staff here and there. A lot of providers had to lay off employees. So home health seemed to do really well. We're seeing a lot of consolidation in that area. And I think they really came out on top. And probably your other big winner is going to be telehealth, which I know Alex can talk about quite a bit too. And we're going to see, I think I was just reading for First Coast Service Options, CMS, and there's the President Trump's issued an executive order to kind of have a task force that's going to look at a commission study on what the opportunities are for telehealth, because it was something that they temporarily said, hey, let's trial this. We're going to let you do telehealth and we're going to expand services during the pandemic. And it actually looks like it may be they're doing some studies to see if there are some things that are here to stay. So on that front, just real quick, before the pandemic, only 15,000 Medicare beneficiaries were receiving telehealth services per week. And during the pandemic, that number went to 24.5 million total beneficiaries started receiving telehealth services. So it'll be really interesting to see, I think, where this goes.
Yeah, Alex, do you have any thoughts on, how we handled the pandemic, how it's, what kind of lessons we've learned from this, and give us your perspective as to who the losers and winners are.
Yeah, and even taking it up a notch to looking at pandemics from a security standpoint, there's a good argument to say that epidemics and pandemics really should be written into our national security doctrine. And this clearly has been a war on everyone, a global war, one that we've only felt in this lifetime. nothing else to compare to it. So I really do think one of the winners is going to be an incorporation of this higher up the political spectrum into the military, and how to respond better to perhaps the next pandemic. I mean, in a way, thank goodness we have this experience to really, button down the hatches and cover our exposed flanks that we found with the best execution of our existing plan that we could. Clearly, a lot of people did die in the way. So there's kind of a win-lose situation there. On the healthcare front, it's been interesting because of what COVID did to the hospitals, and totally agree with everything that that Samantha has had to share. A lot of things happened as operating rooms, as points of care were pivoting and having to find a new way to define themselves, provide medical care to a variety of different kind of patients, and not just COVID patients. And in the process of reforming operating rooms, we found that there's been a fast migration, especially of those elective surgeries that were hit hard, from hospitals to the outpatient clinics. So for those type of procedures that could be done in an outpatient center, there was a lot of growth and a lot of migration. So that alone is opening up a new surge potentially for, either physician-owned or cooperative outpatient centers to be built in the future. And I think that's a plus, right? I think everyone recognizes elective surgeries as the profit driver of hospitals and of any kind of point of care service, a big one at least. So we don't want to lock that down. I think migrating it away from the COVID centers, where just trust alone was difficult to maintain with patients. They wanted to know that they could be in an isolated environment if they're going to go in for a total joint, a total hip, or let's say a laparoscopy. So I think that's an interesting dynamic coming out of all of this.
I think about the Operation Warp Speed and the use of the Defense Production Act to develop new PPE, as successes. Are those things that you envision in terms of lessons learned being more of a permanent feature going forward? I mean, the whole process of having the vaccine approved, tested, tried, and approved is amazing. I mean, typically it takes much longer. Now we're looking at, the vaccine being approved any day now for use here in the United States. I know in the UK it's already being administered. Any thoughts, Samantha, on that?
Yeah, I mean, I think we're in a unique time. Hopefully we won't have to see our Defensive Production Act and other things used quite as frequently or threatened to be used. I think it was a huge wake-up call for a lot of providers, particularly hospitals. I know we talked to a lot of executive groups at hospitals when this all started. And, you had a lot of upset physicians, nurses, because of the supply issues and the shortage. Most hospitals just didn't prepare for something like this. It wasn't something that they had really, thought about, nor do you want to spend a bunch of money and stockpile supplies. I mean, who would have thought something like this would happen? But you also, one of the things I noticed on the provider side was this really interesting dynamic between kind of your staff and your nurses and even physicians who had to come in the hospital. The hospital would say, look, the N95 masks are only for certain uses. And all of a sudden you've got nurses who are going, why is Dr. Bob walking around the hospital with his N95 and he's not treating COVID patients? And Dr. Bob's going, you're not telling me what to do. I brought this from my own practice, and I think this is, the best use of this. I'm going to protect myself. And you had hospitals disciplining physicians. I dealt with a lot of just really crazy issues, really as a result of these supply chain issues. So I think it's something that, again, Alex, you mentioned we're probably going to be writing some things into our national security strategy. I think even on the hospital end, this is a huge wake-up call. That this is not something that we can just put in the back of our minds and really need to be prepared for. So I think we're going to see some interesting changes going forward.
Yeah.
Alex, do you have any thoughts on that?
Yeah, I totally agree, Samantha, especially, supply chain, looking at supply chain at the hospital level, but also at the manufacturer level. And over the last several decades, we know that, multinationals have really proliferated their supply chain globally to really far-reaching parts of the world. And some of those companies were really negatively affected when all of a sudden, not only was there a general lockdown, there were port lockdowns, and you couldn't get access to your technology. So whether that's sensors, chips, microprocessors, but also something as simple as just PPE equipment. Uh, Everyone is in a way talking about more of a regionalization or maybe a return to, having contingency plans on your supply chain and having either access to local or regional supply chain manufacturers, partners, et cetera, and kind of moving away a bit from just in time and lean supply side to more contingency side. And I think that's a very healthy thing, especially when healthcare is such an important component of our lives. And I'd also say, Milton, to your point before, the vaccines and the fast tracking of clinical trials all the way to go to market has just been an absolute miracle in how they pulled that off, especially the big pharma companies. I mean, we're getting into chapter 2, which is going to be the very interesting execution on the logistics of, let's say, 100 million vaccines in the first 100 days, or getting the global population to a herd immunity. That alone we're going to learn so much from that. But the behind the scenes of all the technology that actually made all that possible, and that there was a partnership with the regulatory bodies because of the sense of urgency, because of this global crisis and local crisis, that they really worked well together and broke down some of those old traditional barriers that kept everything slow and too conservative. I think it's going to stick. And I think it's set a new precedent. And it's, again, that technology working in concert with maybe traditional or tech businesses and regulatory bodies that I hope speeds up the process in general across all pharma, biotech, medtech, because these are innovations that we know can be life-saving and definitely life-improving.
I totally agree with you. So let's move on to the next topic, which has been mentioned, which is telemedicine, telehealth. This is to you, Alex. What does the future of telehealth present?
Well, it seems like we're really only in chapter 1, kind of like Zoom and Google Hangouts and all these different platforms. Pre-COVID, there were only certain really necessary people using those technologies. With COVID, we've seen just an absolute surge in telehealth as a substitute, an important substitute to in-person point of care. And if you think about it, it's such a logical improvement of efficiency, time savings, cost reduction. It's almost funny that it hadn't been adopted before, but again, behaviors changed difficultly. And again, I think the traditional go to see your physician, get your vitals, see what your diagnosis is, and then be treated along your illness journey was so baked into the past that it's just amazing how quickly we've adapted. And really, it's almost like 10 years of innovation and behavioral change within a single year. A lot of those things are going to stick just because we all know it was, it took us time and money to go drive to a physician's office, wait in a room full of other sick people. If we had an alternative to just dial in, why wouldn't we, right? Online. And so those platforms are now there. And a lot of them of those platforms have not only become more relevant during COVID, they have pivoted upon their own business plans and become even more value added in terms of the feature rich content that they provide. And it's not just for physician to patient point of care that we're seeing. There's a whole slew of pre-COVID technologies that we've been looking at that serve the adoption of technology. So in other words, teleproctoring, medical education, the ability for physicians, peer-to-peer groups to connect and learn from each other's experience, especially in the surgery, realm of surgery, where use of advanced technologies, robotics, for example, can only be fully appreciated when you look, see, and do, right? And as we've also been limited in our ability to travel, physicians especially, medical education is really taking it on the nose during COVID. If you couldn't travel nationally or even so internationally, well, then you didn't have access to a cadaver lab or to an animal lab where you could practice your own hand on, let's say, some sort of new technology, a procedure, or even a robotic system. So these telemedicine, telementoring type of technologies, which were really built in and around for the physician base that they serve, is not only creating alternatives to in-person learning or training, it's creating even better than in-person training, because imagine a multimodality system where you can see bird's eye view, camera view, clean, crisp audio, multimodality diagnostic information about a patient, and you happen to be, maybe even 5,000 miles away, but it's live, it's in the surgery, and it's in real time. I mean, that's, again, it's going to make life for physicians adopting new technologies and better treating their patients. It's so much faster and richer and maybe even safer, right?
Yeah, thank you for that. Samantha, do you want to chime in on the future of telehealth? And what I'd like you to also cover, being that you're an attorney, are what the risks of telehealth are and what compliance issues, especially in keeping in mind that there's so much exposure to cyber crimes. So go ahead.
Yeah, so what we saw with the pandemic was, as part of the public health emergency, there was a relaxation of a lot of HIPAA security standards that would typically be required. So, you used to have HIPAA compliant technology. You still, to provide telehealth services and get paid for them, you still have to have audio and visual, which is something I think that's important that we had to keep reiterating to providers. Like, somebody cannot pick up the phone and have a visit. That's not going to count. That's not telehealth. That's the telephone. That's a little different. So getting providers, I think, to understand that the services that were able to be provided, let me go back to the relaxation. I think we had the government issued, I think CMS issued, or it may have been OCR, a statement that you did not have to use your typical HIPAA compliant platforms, as long as you could use something that was reasonably secure. And they left that to the providers. They kind of left it open. So you have providers using Zoom, you have providers using Skype. A lot of providers, what I found, were not set up for telehealth, and they got shut down, and they were scrambling right when elective procedures, they couldn't do them. They needed to increase their patients, reach out to patients they hadn't seen for regular evaluation and management type visits. And so they were scrambling, a lot of them, to get to a telehealth platform. And so I think for providers, it's going to be important to realize Skype and Zoom are probably not going to be your platform going forward, nor would those be recommended. You have concerns with working from home. Where are you working? What type of Wi-Fi are you connected to? Can people hack in? Is it secure? How are your images stored? We had physician practice breakups where we had to ask a lot of these questions. Where's your stuff stored? You had a personal computer. You were doing some of these visits from home. Did you download anything from your EMR on your personal computer? So cybersecurity remains a huge risk. Something we also don't really, I haven't heard a lot about, but had an interesting conversation with a healthcare consultant I work with, is how do you verify people's identity? We wonder if there's going to be some fraud going on with insurance where I can just pop on a visit. You're my physician. We can have a face-to-face visit. And then 2 minutes later, I go from being Sam Prokop to Sally Smith, and I have another visit. Or do providers use this to some extent, if to commit fraud where, yes, I did a telehealth visit with so-and-so and you have social security numbers, but how do you prove you actually, saw that patient, or you are who you are? It's not like I can just hand you an ID like I typically do when I go into the physician office. And so I think you're going to have a lot of interesting issues and challenges. We are also seeing some different dynamics between Medicare and government payers and commercial payers. And so that'll be interesting to see. CMS is approving 60 new telehealth services to expand beyond the public health. And it's really related to nursing home, emergency care, therapy, critical care. But right now we're still, we talk about government's hard to change. We're still they're still only applying that to rural health, to rural areas. So, until we get that expansion to be beyond the rural areas, I think we're going to see a little bit slow change. I'm seeing the commercial payers being a little bit more flexible, but usually we end up seeing them jumping on the CMS bandwagon. So it'll be interesting to see after this is all over what really sticks. But I think telehealth is definitely something that providers are going to be looking at.
Yeah. Alex, do you want to talk about cybercrime and how that may impact this wonderful telehealth advancement?
Sure. Samantha made some excellent points. And I think that's the reason why healthcare providers should be signing on with digital platforms that are built by medical device companies. I think medical device companies, health tech companies, they understand that world. They were part of it before. Perhaps they have employees that were within other companies, as opposed to, let's say, Zoom and other tech platforms. So totally agree there. Just to cover your bases on HIPAA or GDPR, if it's Europe, data privacy in general. Interesting about the idea of the fraud component. Yeah, totally see the angles there. And I think we recognize this has been such a surge. There's going to be a period where there's catch up by the regulatory bodies, by auditing bodies to make sure that all of these platforms, meet certain standards. And that really the standards are being created in real time, because of this crisis. But cybersecurity goes beyond the telemedicine platforms. Even devices themselves can be hacked. And because there's more and more of an IoT integration of devices across operating rooms, healthcare systems in general, there are always ways of getting in to systems and hacking. Even through the most, even mundane type of devices, a ventilator, for example, that might have patient information on it, but it's connected ultimately to the hospital information system. Well, is that a gateway to hackers and cybersecurity? Absolutely. So I think all companies across the board are having to, really double down on security and cybersecurity. If it's not part of your business plan, I think you're really behind the times. I think the most innovative companies are really even building it into the front end of their technology, knowing that this is a threat. Let's deal with the threat right from the beginning.
Yeah. So good. We mentioned earlier, Alex, robotics and the use of all this advanced technology in delivering the healthcare service. And also, consumerism, right? Telehealth is a good example. Tell us what you're seeing in terms of drivers of technology that are impacting healthcare and will be impacting healthcare long term.
Yeah. Well, we mentioned it earlier that, in 1 year, we've seen more of a surge in adoption of technology in the healthcare sector and change in behaviors than perhaps in the previous 10 years. A lot of that driven by the factors we already know, and again, a huge sense of urgency. I think that alone is going to be an anomaly, but I think what is good about the adoption behavior of any technology is when you have a guinea pig who can be out there using the technology first in a mass scale before it gets to the healthcare community, that's a good thing. I think we can recognize that, healthcare should be and has been traditionally more conservative. The Hippocratic Oath, in a way, demands it. So innovation and cutting edge doesn't necessarily always go great with patient care. However, if they work in concert, and let's say if a lot of technologies like robotics, like platforms, Zoom and the like, are tested in the consumer market first, iPhones, tablets is another good example. And it becomes mainstream in the, let's say, the consumer or the industrial space first. Well, that's your test site. Then it can migrate into the healthcare world and ecosystems with a lot more confidence. And I think that has definitely driven physician adoption of technology at a faster rate. I mean, iPhone and tablet use alone is now very prevalent across all the operating rooms out there because we know that they're efficient, they're cheap, and it's a great way of integrating technologies. So that is something I can definitely speak to in terms of behavior over the last 10 years. I think it's only going to get better. There still need to be the checks and the balances to make sure that technology is not just adopted because it's something new and novel. It still needs to address an unmet need, shows some important clinical relevance that can be verified through clinical or surgical outcomes. It's not just a fancy new tool. And again, nothing is going to be adopted unless there's a reimbursement element to it, an unmet need, an efficiency driver, of course, because again, ultimately these are tools where the physician and the teams around them are trying to get their patient to better life or productivity or health, right? So fads, I think hype is always going to have its flash bang moment. But I think what we're seeing is a lot of these technologies that had their own tailwind pre-COVID and have had their moment during COVID that's still showing relevance and dynamic adoption means that in 2021 and beyond, those are the technologies that are really going to become the standard of care of the future, right? And we're very bullish on robotics, AI, and telemedicine type of technologies that are the glue that helps stimulate and accelerate adoption at the physician level.
Yeah, I think you call those pre-COVID crisis-proof technology.
That's right, exactly. Yep, and that's what we built our thesis around, because we were anticipating some sort of a financial recession or some sort of a crisis. We didn't know that it was going to be an actual pandemic that, of course, was a health and economic crisis. So good thing is our thesis was in a way stress tested pre-COVID. And so we've really been implementing those technologies or investing in the right kind of companies that are not only relevant now, but into the future.
Samantha, talk to us about consolidation. Earlier during the call, you had mentioned home health was one of the sectors where you're seeing a lot of consolidation. What's driving the consolidation, and what sectors are you seeing besides home health?
Yeah, so home health was one of the biggest ones. And again, I don't know if so much of that was driven by COVID, because a lot of them were winners that, they did pretty well. I think a lot of that you ended up seeing was PDGM was probably it's a new reimbursement model that was out there that I think really separated your smaller home health companies, the different reimbursement model, the metrics that had in the reporting that has to be done as part of it, I think really kind of separated the home health companies that were going to, really take advantage of this and make it and do okay and be able to take a little bit of a temporary financial hit before payments caught up with the new payment methodology. And then we just saw some that were just absolutely devastated. And so now up for grabs. So home health is one of the industries. I don't know that I would necessarily link it to COVID, but obviously we're seeing a lot of consolidation in that area. Hospitals have been interesting. I think the data shows, the studies show right now, hospital acquisitions have kind of been pretty stagnant. I don't know that we've seen really an uptick or a decrease with hospital M&A. Behavioral health seems to be an area where there's a lot more interest. And I think that we can probably link that to the pandemic. And with telehealth services being available, obviously with people home losing jobs, you have, suicide rates increasing, depression rates. I think it really brought to the forefront the need for behavioral health services, the importance of them, and a lot of those services could be provided on telehealth platforms. So I think you're going to see a lot more activity in that space. We saw a lot of new market entrants as well. And I think you're going to see a lot of consolidation, because I think behavioral health is now on the radar. Physician practices were hit really hard, specialty groups, especially, I'm seeing orthopedic groups. I think we're going to start seeing an uptick in consolidation. I think we actually already have. So physician groups, again, reimbursement's a big deal, being shut down if you were doing elective procedures, where you're going to see the need to consolidate. We see insurance networks narrowing still. I'm seeing smaller practices get kicked out of network. And the only way that you're going to overcome that is to get volume and leverage with the insurance companies. And so, and a lot of that, I think, going back to kind of Alex's points with the data-driven the need for technology, there's a lot of reporting that needs to be done. There's a lot of new payment methodologies. And if you're not willing to change and you don't have the technology to keep up with that, ways to track the chronic conditions of your patients and how are you addressing those issues and take advantage of new payment models, you're not going to survive as a healthcare practice. So we see a lot of consolidation in the physician practice realm, whether it's specialty groups and primary care. And you're seeing the accountable care organizations also want to gobble up a lot of these primary care practices. So I'm seeing a lot of consolidation in that area as well.
Okay, so we have about 5 minutes before the end of the panel. Let's do a quick lightning round. Alex, give us your thoughts on the outlook for 2021 in healthcare.
2021 is going to be going to look like a much better version of 2020 because we will still not be completely out of the woods. It's going to take time for the vaccine to normalize life. And I think the throughput of economic activity across multiple sectors. However, a lot of the technologies that are relevant now, that the longer the pandemic lasts with us, the stickier those telepresence, health type of platforms will remain viable options, if not preferred options. Robotics remains robust. It's a target-rich environment. 2021 is when a lot of the new entrants actually come to market with their regulatory affairs and their go-to-market strategies. And if you look at across all the multinationals, there are so many companies that have big exposed flanks. They might be visualization companies that are doing minimally invasive surgery, and they still haven't invested in robotics. And that's where Intuitive is taking people's lunch, and Medtronic, J&J, these are companies that have responded. These are technologies that you can't grow internally as easily. You have to acquire these technologies if you're going to be a player in a short period of time. So those are the areas where we are bullish.
Okay, and you had mentioned previously to me that you thought that more medical professionals will become advisors, take advisory roles in emerging companies. You want to mention something about that?
That's been happening for the last couple of years, and I think as technology and procedures become more complex, it's outside of the realm of the average engineer to fully grasp how to best develop a technology solution that is going to not only fit with a physician's adoption behavior, but serve the need of the patient, right? And I think as that continues, as technology grows, we're going to have a blending of physicians becoming perhaps not just consultants, but employees of some of the biggest multinationals and some of the smaller ones, and helping to guide those companies through the best product development process, so that when you finally get to the end of the road and you're delivering a new solution to the market, it's relevant, it makes sense. All the factors of adoption and healthcare economics are built in to that system. Hence, it has a fighting chance of winning against a competitor or a sea of competitors.
Samantha, your thoughts on the outlook for next year in healthcare?
Yeah, I think instead of scrambling, we can all maybe just take a deep breath and and look at the new opportunities that have been created. I tend to be the eternal optimist. So I think, although we may have winners and losers here, there's going to be a lot of opportunities. From an investment standpoint, I'd be looking at primary care practices. I think they're going to be really the core for these new reimbursement models. We've seen it, and I think they're going to continue to be good targets. And I think some of the struggling practices, I'm seeing practices for sale for almost nothing right now. Physicians just want out of it. They say, employ me, somebody take it over. It's a huge opportunity to maybe look at those, even if they seem a little embattled. When there's a failure, there's also opportunity to improve and grow these things. And with the right leadership in place, you can really turn these around, merge them together, and I think take advantage of some really new, exciting payment and reimbursement models we're going to see.
Okay, great. I'm looking at the chat box. I don't see any questions. I don't see any.
Bill, I got a couple of questions.
Okay, Marty, go ahead, take over.
Okay, so Samantha, just a couple. You were talking about practices for sale. Any particular areas? Because I think that concierge doctors, for example, have done phenomenal business since COVID started.
Yeah. Yeah, your cash-based practices and telehealth, physicians that come to your home, that's actually a really great point. Concierge medicine is definitely on the uptick. I actually have a client right now who just jumped from Medicare world into concierge cash only. I mean, went from complete one extreme to the other, and we're really excited to see what's going to happen there. So there's a lot of opportunity there. And primary care seems to be the focus for patient life. Some of these value-based reimbursement models, ability to contract with Medicare Advantage plans. And I see your general practitioners, your primary care practices. That's where I'm seeing some struggling going on. So I think there's a lot of opportunities there for cash infusion, partnership, different opportunities.
Right. And Alex, I just had a quick question about, data. I know you're talking about healthcare professionals joining on advisory roles, et cetera, but to me, a lot of what you're talking about seems to be this, data that's collected. And maybe you talk like a fraction of a bit about data and the role it plays, because, one of the things, I've done a lot of stuff in San Diego. There's a lot of, group sharing apps for people that wear Fitbits. It's almost all performance driven, right? But people being able to see real time, information on how their body performs. You get tired in the afternoon, you run better in the morning, et cetera. Maybe you can talk a little bit about that.
Sure. In a couple of different contexts, Marty, thanks for the question. I mean, in a way, the future, we know data is going to drive almost everything. Everything from better diagnosis of patients, better surgical planning with tools like artificial intelligence and machine learning. Again, data alone doesn't help. It's got to be the right data in the right context, used with the right type of, let's say, system. But with data becoming kind of the thing that's driving a lot of businesses, I think companies in the future are going to get very good at utilizing the data that they have, either about their client base, the usage of their products, perhaps even in a healthcare context. And that's going to drive, I think, new businesses of the future. It might not come from the same device manufacturers. It's going to come from other spinoffs, other startups that see an opportunity and take data, provided it's good data and it's HIPAA quality, right? HIPAA compliant, and turn that into new business opportunities. So I think we're just getting started with data as the new oil in healthcare.
Sure. And actually, there's some really great data VC firms that are healthcare oriented in San Diego as well. Just, my only other comment is that as much as COVID has been a disaster for most healthcare, especially for those people who are into fitness and your gym's been closed down, et cetera, I think it's actually really fantastic in terms of being able to be reflective upon life and about, what's important. Because, if people aren't getting out and they're not able to see advertising on real estate and billboards, well, that's actually kind of good that you're not fed messages all the time. And for me, all I need to do is just put my cell phone away and I'm turned off from the world, right? So I can just get like a nice little Faraday cage bag, throw my cell phone in it, and I'm cut off. So in some respects, when you reflect on everything, for all the bad that's happened, there's a little bit of a silver lining, which is you can step away from things. And you're not, anybody who, I lived in Philadelphia for years, you drive to Atlantic City, every other block is a billboard about gambling, back in the day. And there's still billboards out there, but you can walk away from that, right? Today, that's not as invasive. So, I think, as bad as things have been this year, I think things are looking up for next year. And I think the most important lesson learned is to be reflective on what's happened the last year in every way. So thanks so much, you guys, for presenting.